Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. First of all, I would like to introduce myself, Dr. Mohamad Shahrir Abdul Rahim, Nuclear Medicine Specialist from Kulliyyah Medicine. So we will discuss briefly regarding radiation protection, regulation and guidelines. Our outlines, first I will just touch briefly regarding radiation and source of radiation, and then we'll go to the biological effect of radiation, objective and principle of radiation protection, and then basic principle in protection of radiation worker and other parameter in radiation protection. And I will share with you some guideline and regulation. What is radiation? It is energy in the form of wave or particles. Generally it is invisible, no wave, odor, no positive or negative charge, but some can be seen or felt, and mostly we can be detected with special instruments. We live in the source of radiation. 80% of the radiation is coming from a natural source, and another 20% is a man-made. And the largest man-made radiation is from the X-rays. And radiation we can divide into ionizing radiation and non-ionizing radiation. Ionizing radiation is the one that we more focus because it can give harm to the body. And non-ionizing radiation, example like microwave, ultrasound wave, and other wave that mostly are not give the impact to the directly impact to the tissue. And ionizing radiation we can be divided into direct or indirect ionizing radiation, meaning that the effect of the radiation can cause direct impact or indirect impact. So we go to the biological effect. Why this what we call radiation protection is important? Because when the patient, when we expose to the radiation, it can cause a certain biological effect. So it can be, like I said, direct or indirect. So if it is a direct damage to the cell, first the cell will be undamaged because maybe the amount of radiation is very low, so cell may not be undamaged. And if there is a damage, cell can repair and work normally back. But when the dose increase, there may be the cell can repair, but it can cause abnormal. And if the dose is large enough, the cell may be die. So this is a 4 outcome if we have a direct damage to the cell. And indirect damage, so this ionizing radiation, it can cause the what you call the development of the chemical changes and produce a free radical. Usually you heard about the free radical. So this free radical, if it's a lot enough, it can turn into the damage of the molecule or the tissue, the molecule itself, and then it can cause the abnormality of the tissue and cause cancer. And also from the biological effect of radiation, we can divide the effect of the exposure of radiation into the deterministic effect or stochastic effect. Deterministic effect also they call a non-stochastic effect. So deterministic effect, usually it will deliver in a short space of time, and it has a threshold. So the important is that we have the threshold for this deterministic effect. When the radiation exposure is achieved in certain threshold, there will be some biological effect that can be seen. And below the threshold, usually there is no clinical effect. And the second one is stochastic effect. So stochastic effect is more on probability. So it will increase with the increasing of the dose. So there is no certain threshold to achieve to see a biological effect to the body. So it has no threshold and no lower dose limit. It's more on the probability effect. So with the increasing dose, there will more increase higher chance to get the damage or the effect to the body. But in the low dose also, you can also have the effect to the body. So the important radiation effect you can cause from the molecular up to the tissue organ. So this effect is disrupt all the functional effect of the body. Okay, example of the exposure level. If you see here, below 0.5 sievert, there's no noticeable symptom. And then when we increase to the 0.5 above, there will be a certain certain reaction or certain symptom that can be raised that we can see, like mild radiation sickness. And then if you go to more increased exposure, you can see there's a fatality, acute radiation poisoning, and then depend on the amount of the exposure. If we more than 10 sievert, it can cause a fatality after 7 days. So the objective of radiation protection, first, we want to prevent the harm to the worker and others when we use the radioactive material or hazardous equipment or radiation equipment. And then the safety, actually want to reduce the exposure to the worker or handling source. But in all, we want to minimize the health effect due to the radiation. And we have a three principle of radiation protection. First is justification, second is optimization, and third one is a dose limit. So justification is very important. So when we want to subject any patient or subject any procedure, or want to do a procedure that involve the radiation, so we must justify the need for the procedure. So the procedure is very important. Either it can give a valuable or benefit, or we can give a benefit to the patient or not. If it doesn't change the management, so it will not justify to do the procedure. So apart from this, the dose limitation is only applicable to the workers and public, but not to the patient. So we go to like I said, the justification must have a benefit, because if not, because it causes radiation harm to, and also it will incur the cost, and also it will be inconvenient to the one that we are exposed to, and also the one that handle the procedure. And like I said, the intervention must provide the benefit. Okay, optimization. So when we already have a justification, so we must optimize the procedure to make sure that the one that we do to the patient have really give a benefit. So in the radiation procedure, we divide into a diagnostic or to therapeutic purpose. So for diagnostic value, we must optimize the one that the procedure that we do by performing with a sufficient radiation to achieve the diagnostic image of diagnostic value. So there's what we call certain what we call as low as reasonably achievable. This is scheme that we usually the person, if you go to the radiation protection, they will say about ALARA or ALAP, radiationable practicable. So this is the aim that we want when we do a procedure to optimize the outcome, and also to reduce the radiation to the worker and also to the public. And for the therapeutic purpose, we want to achieve effective pathological tissue damage without compromising the healthy tissue. And all this, that either diagnostic or therapeutic, you should follow the common accepted practice of guideline. And dose limit. So for the radiation worker, and for the public, there's a certain dose limit that we need to adhere, we need to follow, to make sure that the exposure to the worker and the public are not cause the harm effect to the tissue. And there's an annual dose limit that you can get different categories with different dose limit: radiation workers, members of the public, trainees, female pregnant workers. So this is homework for you. I will attach, give also to you the PDF format of our BSRP, Basic Safety Radiation Protection 2010. So usually in our country we follow this act to make sure that all the radiation worker and public are in the low level of the exposure. So for you, you need a further reading to read this annual dose limit for every categories, and at least you remember if you want to, yeah, for this semester. And then it's very important to know this dose limit. And after that, we have a basic principle in protection of radiation worker. We have three important basic principles to make sure that we can reduce the radiation to the worker. The first is shielding, time, distance. You can remember. How do you remember? It's depend on you. So STD is not a sexual transmitted disease. It's a shielding, time, or distance. Either you want to remember time first, shielding first, distance first. It depend on you. So we go to the time first. So the amount of the exposure is proportional to the exposure of the time, meaning that it's easy to understand that when you want to minimize the exposure, so you have to minimize the time that you expose to the radiation. And mostly for the external exposure, we are more concerned on the gamma and also X-rays. So the longer the exposure time, the higher is the dose received, and it is vice versa. And therefore, the internal exposure, if radioactive material get inside to your body, or we inject usually in nuclear medicine, we inject the patient with the radioactive. So the amount of exposure is depend on the for the patient is depend on the physical half-life, biological half-life, and also effective half-life. Like I said, we are more concerned on radiation worker. So for this internal exposure is more on patient side. But as a radiation worker, we still have to think about we want to give the patient or we want to optimize the patient condition. We want to optimize the patient when we give the radiation with and produce a good quality of the image or diagnostic image without assessing as we give the excess radiation to the patient. And then this physical half-life is depend on the type of radiation that we give. Biological half-life is time that how the body eliminate the radioactive, and effective half-life is the combination of the physical and biological half-life. So they have a certain effective half-life or certain radiation type of radiation. So we go for a distance for further away. So further away people, so the radiation will be less. So this imply the inverse square law. So the inverse square law said the reduction of radiation dose is inversely proportional to the square of the distance. I is intensity, dose radiation. So inversely proportional to the square of the distance. So if you double the distance, so you reduce the exposure by a factor of 4, because we have a square of distance. And by we half the distance, so we increase the exposure by a factor of 4. So more nearer, more increase. If you go further, we reduce the exposure. So this is an example of how you calculate the dose rate, and also how you to find the distance when we give some of example of dose rate. So this dose rate of 2 meter, gamma source is about 400 millisievert, the exposure, the intensity. So what are the distance? We'll give a dose rate of 25 millisieverts. So by using this formula, you can get about 8 meter. So if you want to calculate the dose rate of 25 millisievert, so you must go further about 8 meter. Okay, so I can give you this in the examination. We can give you this type of question, so you have to remember the formula. Then we go to the third principle, basic principle is shielding. So shielding material attenuate or absorb the radiation. So is the kind of thickness and shielding required depend on the radiation or the type of radiation that we use. So if you see here, alpha ray, beta ray, gamma ray, this is the source of radiation. So different source of radiation can be stopped or can be shielded by a different type of material. Alpha ray only by the paper, piece of paper. Beta ray we can stop by your hand, and gamma ray you need about few milliliter of lead. So different radiation energy, different type of materials. And also you must remember this is a personal protection. If you use we also must shield the building. If we use the like X-ray machine or radioactive inside the laboratory hot lab, so we need to shield also the wall of the building to make sure that radiation inside are not go to the outside of the center. And this is some of personal protective device that can be used to protect the worker. So we have the apron, lead apron. This is all the lead apron, thyroid, shield, glove, gown. So and then we have the equipment that we use to reduce the radiation during our preparation of the radioactive material. We have a tabletop lead. So we will process all the we'll prepare all the radiation, the radioactive behind of this tabletop, and we have a lead shrink shield. Before we inject to the patient, we must cover the shrink with this lead shrink to reduce the radiation exposure to the worker. And we have a lead carrier. So before you want to carry this radiation from our hot lab to the patient, so we use this lead carrier to reduce the radiation to the worker. Other parameters that you also should consider is about the first classification of area, radiation monitoring and personnel monitoring, safety handling of radioactive material, records and training. So classification of area, actually the classification of area you have I like you to go a further reading on the BSRP 2010. So we have three areas that can be classified for the department that use the radioactive, especially nuclear medicine: control area, supervised area, and clean area. So this control area usually the place that we prepare the radioactive, and supervised area usually the place that we image or we prepare the patient or image the patient, and clean areas is the patient waiting or the reception part. So I need you to read in the BSRP 2010 the definition of this classification area. And for radiation monitoring and personnel monitoring, usually this is important for detection of contamination in the department, in the area. And usually we use a survey meter to survey any radiation spillage or contamination, either during the delivery of the radioactive, during the preparation, and after giving to the patient, and for the waste. And then the importance of personal monitoring to make sure that we can calculate how much the exposure of radiation of the worker after doing the procedure, to make sure that the worker is in the safe side or in the safe side, and also will have a significant exposure to make to harm the body of the patient of the worker. So we have a film badge, OSL, TLD. This is a type of the personal monitor that the worker or radiation worker should wear to calculate how much the exposure to the worker. And then some regulation and guideline that you have to know. The authority body in our country, regulation, the main regulation that we refer, and some guideline that we follow or we modify. Okay, regulation. The strong body in our country is AELB, Atomic Energy Licensing Board, and we have a Radiation Act 304. This is the Radiation Act that we follow in our country, and within this Radiation Act we have the BSS or BSRP 2010, the one that I asked you to refer, and I will give you PDF form for this Act and also BSRP. And also we have the international body, International Atomic Energy, IAEA, which usually they give a guideline and recommendation, and it depends to us to either to accept it or modify it according to our country. And also we have an ICRP, International Commission of Radiation Protection. They also produce a guideline or recommendation to all the country to make sure that it's in line to the research or the research and also the finding that they get throughout the world. So we have ICRP 60 and ICRP 103, mainly on radiation protection. So this is the law of Malaysia. So this is our reference, main reference. And atomic, we inside the law we have the subsection where we call BSRP, Basic Safety Radiation Protection. So kindly, for the reading, you read this BSRP because it's more on how to guide us using the radiation or the radiation to the medical use. Okay. I said the authority body, Atomic Energy Licensing Board, Lembaga Perisian Tenaga Atom, and mostly they handle the non-medical usage of radiation. For medical usage of radiation, mostly it will take over by the bahagian kawal selia radiasi perubatan in Ministry of Health. And for the radiopharmaceutical itself, it must go to the National Pharmaceutical Regulatory Agency to make sure that this radiopharmaceutical is up to the standard and is not have any side effect or poison before using in the medical use. So these are three body that important. And for the medical use, these two body, bahagian kawal selia radiation perubatan and National Pharmaceutical Regulatory Agency, is an important body to make sure that the use of the radiation or radiation in our for the usage of medical radiation is being observed and also have a good SOP and guideline. So International Atomic Energy Agency, IAEA, mostly give a recommendation and guideline, and ICRP also give a recommendation and guideline internationally. Okay, this is ICRP guideline. So the latest one is 103 2007. This is our reference. Okay, thank you. So hopefully during the our session you can ask me or you can give what are the any question regarding this topic, and then kindly refer to the BSRP that 2010. You can download inside you go to the internet, you just type BSRP 2010 Radiation Act, you can get that PDF inside the internet itself. Okay, thank you very much.